In this video, we're going to try and wrap up some remaining questions and also think about how do you navigate things going forward? What is the psychiatrist's role in my care? The role of the psychiatrist in your care will very much depend on who you're working with and what type of organization they're working within. If you're working with someone in private practice who really enjoys doing the psychotherapy side, they may be both your psychotherapist as well as the prescriber of medications, versus if you're working with somebody who is in a large organization such as Kaiser, the psychiatrist is pretty strictly going to be focused around diagnosis and medication management. There's a whole spectrum in between, and many psychiatrists will infuse a little bit of psychotherapy with the medication management they're doing. Some psychiatrists view themselves as really focusing on just managing the medications, whereas others will really take a greater sense of almost being like your primary mental health doctor, like a primary care doctor, but for mental health. And that'll include any sort of mental health issues that you're going on and helping to manage your treatment in general. How can I stay in the driver's seat of my treatment decisions? At Anxiety Relief Clinic, we really believe it's important for you to both be and feel like you are in the driver's seat for your treatment. That's because if you start to get in a situation where you feel like you're doing things because you think you should do them, that can lead to spirals of guilt and shame rather than trying to attach to like, how do you want your life to be and how can your providers support you in getting there. It's my goal in working with folks to help empower you and to help you to feel like you have the decision or the information you need to make a decision that's right for you. One good way to stay in the driver's seat is to ask yourself when you're having a visit, what is the thing that I want and how does this decision affect what I want and what I don't want? It's also important to think about the cost, whether that be time, risk for side effects, or other downsides to any decision. Overall, it's good to think not just about what's happening right now and in the immediate future, but what are your goals? How do you want to feel at the end of the day? How do you want to feel at the end of this calendar year? What are reasonable expectations for what medication can and can't do? Medications are a part of the treatment plan, but rarely the only thing that you need to do in order to feel better. For many people with OCD or related disorders, once you're on a sufficient dose of the medication, you can feel much calmer and the thoughts that bother you normally today become much quieter, less sticky, and when coupled with psychotherapy and lifestyle changes, the issues are no longer a part of your day-to-day life. Some people aren't quite as lucky and find that medications just help a little bit, and they really need to focus on the therapy and lifestyle changes in order to get the rest of the way. What are the signs that my current treatment plan isn't enough? The two most common times that people come to see a psychiatrist ready to start medications are when you feel like you're starting treatment for the first time and just very overwhelmed and really needing help, or you've been working in therapy and you're hitting a wall. So for example, you were doing exposures, you were making lots of progress, but now it just seems like the same things keep coming up again. Even though you've tried the exposure, it's not getting better. Or you take care of one exposure, it gets better, but something else reemerges right next to it. For these folks, people often decide, you know what, I think it's time for me to give medications a try and add that to my treatment plan. Can you share success stories about people who found relief with OCD medications? One of the reasons that I love working with OCD and people with related struggles is how much better we get to see them get with treatment. That can happen with the therapy, but very much so with the medications as well. This isn't always the case in psychiatry, where we're often working with people that have really difficult to treat symptoms. But for OCD, people really get better. I have most of my patients that I've worked with over the years are in a much better place since we've started working together and they've been taking medications than they were before we started treatment. It's not about one or two anecdotes, it really is the majority. How do I know if it's time to see a psychiatrist? It's the right time to see a psychiatrist if you're watching this video. What I mean by that is you don't need to be ready to start medications, you just need to be ready to ask questions. Whether that be about medications or wanting a physician's perspective on their OCD and what's going on, we can be helpful and it's important to reach out. If you're concerned and you really don't feel ready to start medications, that's okay. Any good psychiatrist will be willing to talk with you anyways.